Hi, my name's Ted O'Connell. I'm the author of USMLE Step 2 Secrets. This is number 51 through 75 of the top 100 secrets. Let's get started. Drugs of abuse. Those that are potentially fatal in withdrawal include alcohol, barbiturates, and benzodiazepines. Alcohol, cocaine, opiates, barbiturates, benzodiazepines, PCP, and inhalants are potentially fatal in overdose. Pelvic inflammatory disease is the most common preventable cause of infertility in the United States and the most likely cause of infertility in younger, normally menstruating women. Polycystic ovarian syndrome, or PCOS, is classically associated with women who are heavy, hirsute, and amenorrheic. It is the most common cause of dysfunctional uterine bleeding. Remember the increased risk of endometrial cancer as a result of unopposed estrogen. Fetal and neonatal macrosomia is caused by maternal diabetes until proved otherwise. Use diet and insulin, not oral agents, to treat maternal diabetes. Causes of low maternal serum alpha protein levels include Down syndrome, inaccurate dates, which is the most common cause, and fetal demise. Causes of high maternal serum alpha-fetoprotein levels include neural tube defects, ventral wall defects such as omphalocele and gastroschisis, inaccurate dates, which is the most common cause, and multiple gestation. Measurement generally is obtained between 16 and 20 weeks gestation. Hypertension plus proteinuria in pregnancy equals preeclampsia until proved otherwise. Positive pregnancy test plus vaginal bleeding and abdominal pain equals ectopic pregnancy until proved otherwise. Order a pelvic ultrasound if the patient is stable. Decelerations during maternal-fetal monitoring. Early decelerations are normal and caused by head compression. Variable decelerations are common and usually are caused by cord compression. So turn the mother on her side, give oxygen and fluids, and stop oxytocin administration. Late decelerations are caused by uteroplacental insufficiency and are the most worrisome pattern. Turn the mother on her side, give her oxygen and IV fluids, stop oxytocin administration, and measure fetal oxygen saturation or scalp pH. Prepare for prompt delivery. Always perform an ultrasound before pelvic examination in the setting of third trimester bleeding, in case placenta previa is present. Uterine atony is the most common cause of postpartum bleeding and is typically caused by uterine overdistension, such as in twins or polyhydramnios, prolonged labor, and/or oxytocin administration. Acute abdomen pathology localization by physical examination. In the right upper quadrant, think of gallbladder and biliary causes such as cholecystitis and cholangitis, or liver causes such as abscess. In the left upper quadrant, think of the spleen, such as rupture with blunt trauma. In the right lower quadrant, think of the appendix, such as appendicitis or pelvic inflammatory disease. In the left lower quadrant, think of the sigmoid colon for causes such as diverticulitis or the possibility of pelvic inflammatory disease. And in the epigastric area, think of the stomach, such as peptic ulcer disease, or the pancreas, such as pancreatitis. The six W's of postoperative fever include water, wind, walk, wound, wawa, and weird drugs. Water stands for urinary tract infection. Wind stands for atelectasis or pneumonia. Walk stands for deep venous thrombosis. Wound stands for surgical wound infection. Wawa stands for breast, usually relevant only in the postpartum state. And weird drug stands for drug fever. In patients with daily fever spikes that do not respond to antibiotics, think about a post-surgical abscess. Order a CT scan to locate it, then drain the abscess if one is present. The ABCDEs of trauma, and follow in order if you are asked to choose. A for airway, B for breathing, C for circulation, D for disability, and E for exposure. 6 rapidly fatal thoracic injuries that must be recognized and treated immediately. Number 1, airway obstruction, so establish an airway. 2, an open pneumothorax. Intubate and close the defect on 3 sides. 3, tension pneumothorax. Perform a needle thoracentesis followed by chest tube. 4, cardiac tamponade. Perform pericardiocentesis. 5, massive hemothorax. Place a chest tube to drain. Perform a thoracotomy if bleeding does not stop. 6, flail chest. Consider intubation and positive pressure ventilation if oxygenation is adequate. Neonatal conjunctivitis may be caused by a chemical reaction in the first 12 to 24 hours of giving drops for prophylaxis. Gonorrhea, 2 to 5 days after birth, and is usually prevented by prophylactic drops. And chlamydia infection, 5 to 14 days after birth, often not prevented by prophylactic drops. Glaucoma is usually the open-angle form in 90% of cases, and this is painless and asymptomatic until irreversible vision loss that starts in the periphery occurs. Screening is thus very important. Open-angle glaucoma is the most common cause of blindness in African Americans. Uveitis is often a marker for systemic conditions such as juvenile rheumatoid arthritis, sarcoidosis, inflammatory bowel disease, ankylosing spondylitis, reactive arthritis, multiple sclerosis, psoriasis, or lupus. Photophobia, blurry vision, and eye pain are common complaints. Bilateral, painless, gradual loss of vision in older adults usually results from cataracts, macular degeneration, or glaucoma, which can be distinguished on physical examination. Presbyopia is a normal part of aging and affects only near vision, that is, accommodation. Compartment syndrome, usually in the lower extremity after trauma or surgery, causes the 6 Ps. Pain, which is often present on passive movement and often out of proportion to the injury. Paresthesias, resulting in numbness, tingling, or decreased sensation. Pallor, or cyanosis. Pressure, or firm feeling in the muscle compartment and an elevated pressure reading. Paralysis, which is a late ominous sign. And pulselessness, which is a very late ominous sign, which should be treated with fasciotomy to relieve compartment pressure and prevent permanent neurologic damage. Peripheral nerve evaluation. Here we're looking at the radial, ulnar, median, axillary, and perineal nerves. The radial nerve motor function is responsible for wrist extension, so watch for a wrist drop. Sensory function is the back of the forearm, the back of the hand, and of the first 3 digits. In the clinical scenario in which abnormality may be seen is in humeral fracture. The ulnar nerve is responsible for finger abduction, so watch for a claw hand. Sensory function is the front and back of the last 2 digits. In the clinical scenario in which this can be disrupted is elbow dislocation. Median nerve is responsible for pronation and thumb opposition. Sensory function is the palmar surface of the hand of the first 3 digits. In the clinical scenario, carpal tunnel syndrome or humeral fracture, the median nerve can be disrupted. Axillary nerve is responsible for abduction and lateral rotation. Sensory function is the lateral shoulder. And clinical scenario is an upper humeral dislocation or fracture when the axillary nerve becomes disrupted. Perineal nerve is responsible for dorsiflexion and eversion, so watch for a foot drop. Sensory function is the dorsal foot and the lateral leg, and it may be disrupted in knee dislocation. Pediatric hip disorders. Congenital hip dysplasia is seen at birth. Epidemiology is female, firstborn, breech delivery. Symptoms and signs are the Barlow and Ortolani signs. Treatment is harness. Leg calf Perthes disease is typically seen at 4 to 10 years of age. Epidemiology, look for a short male with delayed bone age. Symptoms and signs, pain in the knee, thigh, or groin as well as a limp, and treat with orthoses. Slipped capital femoral epiphysis is typically seen at 9 to 13 years of age in an overweight male adolescent. Look for pain in the knee, thigh, groin, as well as the presence of a limp, and treatment is with surgical pinning. Avoid lumbar puncture in a patient with head trauma or signs of increased intracranial pressure because of the risk of herniation. Perform a CT scan without contrast instead. In children, 75% of neck masses are benign, but 75% of neck masses in adults are malignant. In children, suspect lymphadenitis or a thyroglossal duct cyst, while in adults, look for squamous cell carcinoma, metastases, or lymphoma. The management of symptomatic carotid artery stenosis of 70 to 99% is with carotid endarterectomy. Less than 50% is treated with medical management, that is, antihypertensive agents, statins, and antiplatelet therapy, and treatment of atherosclerosis risk factors. For stenosis in between these two measurements, at 50 to 69%, the data on management is less clear, and patient-specific factors such as comorbidities affect the decision. Pulsatile abdominal mass plus hypotension equals ruptured abdominal aortic aneurysm until proved otherwise. Perform an immediate laparotomy because there is a 90% mortality rate associated with ruptured AAAs. That's the end of Secrets 51 through 75. We hope you'll join us again for the next lecture. Thank you.